Each year, millions of Americans face the reality of living with a mental illness. May is National Mental Health Month, where there is a national movement to raise awareness about mental health, specifically applying to the message that you are not alone. Joining us now is Providence's Kristen Filer to talk about some of the common signs and symptoms you might see that someone or someone you love may have a mental illness, so that can help guide them to get the help. What are some of those signs that we should be looking for?
Well, there's a lot of common signs and symptoms, and there's a whole slew of symptoms. And I say that just because I want to make sure people understand that if you're experiencing a symptom and it's not necessarily one of the common ones, it doesn't mean that you don't have an illness going on that you don't need treatment for. It's really difficult with mental illness. It's not like diabetes or cancer where you have a blood test that tells you that you have this going on and this is the treatment. That you have a diagnostic and statistical manual for mental disorders that kind of helps guide psychiatrists and practitioners to figure out what's going on with you. And there's a whole slew of symptoms. So keep that in mind that, not one size fits all, and there's a lot of different ones. But the common ones that you will see in adults and adolescents, and I'm including adolescents because they are a huge part of the population, as are kids. In fact, 1 in 6 to 17-year-olds experience a mental disorder. That's a huge part of our kid population. And the caveat with that too is that those that have a mental illness, 50% of them will have experienced it by the age of 6 years old, and 75 will experience it by the age of 24. So that's huge that these kids are starting to experience these mental illness. So with adults and adolescents specifically, you're going to see a lot of excessive worry, a lot of fear. That seems pretty common, but that is a really big one. There's also extreme mood changes. So there's this extreme between feeling really depressed, feeling really low, not the inability to be able to perform your daily activities, where you can't even get out of the bed, or you can't even clean your house or do your daily things, shower, things like that. But then also this huge swing where you have this uncontrollable high, where you're feeling euphoric and happy, and there's really no way to control it, and you're not really too sure what's going on. Also avoiding social activities, and not because it's the cool thing to do, but because that is something that gives you so much fear. Changes in sleeping habits, eating habits, and then also a difficulty perceiving reality. So sensing or experiencing things that are not in our objective reality, that can be auditory or hallucinations, or sensory hallucinations, and then also overuse of substances, all really common for adults and adolescents. Now with kids, there's also kind of the same signs and symptoms. With them, you're going to see a lot of ADHD, or this hyperactivity where they cannot focus on one thing. You see a lot of behavioral problems, anxiety and depression. Those are the common mental illnesses with kids. And that will manifest in usually their school performance. They're usually hyperactive behavior at school, just changes in their school performance, but also this excessive worry and excessive anxiety where they fight to go to school. They don't want to go to school. So, like bedtime, they fight to go to bed because they know that they have to get up in the morning and go to school, and not for the usual reasons that we all don't want to go to school, but because there's an extreme fear or anxiety there. You'll also see frequent nightmares, frequent temper tantrums, more than the usual temper tantrums, and frequent, disobedience or aggression in a kid. So those are all really common for kids, that if you see to start getting treatment for them. And remember, there's no one size fits all for this. It's not, like I said, not like cancer, not like diabetes where you have a certain treatment. There is a whole slew of things that you can do: medication, counseling, lifestyle changes. But the biggest one too can be education. And it's really hard to tell the difference, when it comes down to it, between a sign of a mental illness. Is this the normal behavior in a person, or is this behavior that's manifested because of a physical illness that they're having? So just things to kind of keep in mind, and remembering too to take that stigma out of mental illness. It's not a dirty word. Just because your illness happens in your head doesn't make you any less of a person. Just like diabetes and cancer happen to a person, that doesn't make them less. We all know that mental disorders are not just lifestyle, they are genetic, they're hereditary, they're brain chemistry issues that need to be fixed or worked on. Same thing too, like with diabetes and cancer. These are things that happen in your body. It doesn't make you a less of a person if you have cancer, it doesn't make you a less of a person if you have a mental disorder.
And I think that phrase of saying, you are not alone is so good for this, because a lot of those symptoms are things that everyone can be experiencing. So definitely knowing
Absolutely.
that you're not alone.
Yeah,
in this.
one in 5 Americans have it, and with this pandemic, we're seeing an increase in that. So
Yeah, well, Providence,
definitely not fun.
thank you so much for those tips, and I think that's a great message to share, is that you are not alone in this. Thank you.
Thank you.